Good morning, everybody. I thank the IIHP for giving me this opportunity to present my views. So today my topic for this seminar, this scientific seminar is an approach to DMD, that is Duchenne's muscular dystrophy.
దానికి వైర్
So
ఇస్తా
friends,
మామూలు వైరు వైర్ ఇస్తాను వైర్ అక్కడ కనెక్ట్ చేసి
am I audible now? So friends, this was a child who came to us, a 4-year-old child came with the complaints of feels heaviness in the legs. So his parents took him to the doctor. Seeing the severity of the pain, the doctor suspected something and advised to do an investigation of serum creatinine phosphokinase, that is the CPK level. The CPK levels were raised tremendously. The CPK levels was 14,820 and the normal CPK levels were around 10 to 120 mcg. So this child was diagnosed as suffering from Duchenne's muscular dystrophy. I know many of you are students over here. So what is CPK? CPK is an enzyme which is released when the muscle is damaged. So this is a diagnostic test for any kind of muscular problem, muscular dystrophy and the Duchenne's muscular dystrophy. So this child was diagnosed as CPK, Duchenne muscular dystrophy DMD, and the initial level was 28,380. So friends, what is the scope of homeopathy in such cases? Yes? What is DMD? I would like the audience to respond so that we can have an interactive session. So what is the scope of homeopathy in these cases? My presentation today will be to make you aware of the scope of homeopathy, what homeopathy can do, so you all get motivated and start practicing homeopathy. It's very good to see that many of you are students over here and there is a lot of motivation which is required for the younger generation to understand the scope of homeopathy and to pursue homeopathy as a career. I've seen many students today, they don't want to practice homeopathy because they feel that homeopathy is not so effective and it is effective only in cases like skin disorders or cases like asthma and psoriatic complaints. But friends, the scope of homeopathy is tremendous. Now, how do we approach these cases? Yes? Any idea, suggestion? Can we have a mic, please? How do we approach these cases?
Hello. Hello, good morning, sir.
Good morning.
Sir, I had 4 or 5 cases of DMD, and what I know of, it was a long time back. What I know of DMD is that it usually occurs in males. The females are somehow, they are not affected. And what the CPK levels are always high. With homeopathic medicines, I was able to bring down the CPK levels. There was a stagnation of the symptoms, and the signs. It means the patient was able to walk, he was able to get up, but somehow the other, it's a long-term therapy, and most of the time they sort of fall away from treatment. So I don't have much experience except I had 3-4 cases of DMD.
So very good. Same experiences here. The case which I am going to share today is a case of many years back. This patient came to me in 2015. And that time my understanding and approach was quite different. I was still trying to understand how to approach these cases. So friends, here what I am going to, it is not that I am going to show a case of DMD being better. but I want to develop an understanding amongst everybody that how do we approach these cases. So what is the basic approach we do when we see a case of DMD? The DMD is basically a genetic disease, right? So allopathy has got a limited scope. The child is put on steroids and then the life expectancy is very small. So friends, where my teacher Dr. Pravin Jain is always used to say that where allopathy ends, homeopathy starts. So today my approach or today my sharing of these cases with you is to make you aware and follow that we all can do this. It is not that I can do or somebody else can do, but we all can do this if we understand the problems. So how do we approach these cases? What are the steps? Like suppose this case come to you, what do you do? Yes, any idea, suggestions? Take the mother's history during pregnancy. Somebody says that take the mother's history during pregnancy. Do we all agree to this? Say yes loudly. Morning we all had a breakfast, good breakfast. Mother's history during pregnancy, should we take that or not? Why? It's a genetic disease. So what options we have? We have take the mother's history during pregnancy. Second option is to take the father's history during pregnancy. Why mother only? Why not father's history during pregnancy? That is also, father is also one of the responsible factor for the child, right? Why not father's history during pregnancy? Or give some specific remedy like Varada calf or Calcarea calf, Rustox, or give some specific remedy to this child and expect that we can reverse the process. Or somebody said that take the child's totality. Forget about the mother's history, take the child's totality and prescribe for the child. So we have these various options in front of us by which we can address the problem. Friends, this is the problem which I face. So what I am going to share with you, see, it is not a lecture or a presentation. I am going to share what I went through. This is the same way which I went through. So when this case came to me, I was confused. Mother's history, father's history, child's remedy, specific remedies. So friend, everybody has these cases in their clinic. I am sure all the practitioners, everybody has these cases, such kind of genetic cases in their clinics, and they give good results. But it is always like a hit and miss. If a patient goes to 10 different homeopaths, all 10 will prescribe different remedies. So Hahnemann has said law of individualization. When he said law of individualization, he didn't mean that a patient goes to 10 different homeopaths and they all prescribe different remedies. We have to individualize the patient. So everybody has such results in their clinic where sir said that he has a patient of DMD. Somebody said that he is a patient of Down syndrome. Everybody has such patients in their clinic and everybody is giving result. But the problem is nobody gives result with certainty. Are you confident when you see such cases? Yes, I will be able to give result. This certainty is missing. Are you following with me? हमारे पास केसेस आते हैं लेकिन हम ये सर्टेनिटी से नहीं, ये मैं ठीक कर सकता हूँ. जैसा whenever we see a case of asthma, we say that yes, I will be able to cure it. When we see a case of psoriasis, we say that yes, I will be able to give result. But when we face such cases, can we talk of yes, I will be able? Can we be certain about the treatment? And why do we fail? We fail because the most important aphorism we forget. Aphorism number 3, where Dr. Hahnemann talks of knowledge of disease. Organon, we all have read in our college days and we read for exams and then we forgot. We don't apply organon in our day-to-day practice. Because the language of organon is little difficult. to interpret, and everybody has got its own interpretation. One of my teachers, Dr. Sanjay Naidu, has written a beautiful book on organon where he has simplified the language of organon. Organon is very simple, but what it is, we misinterpret. So in aphorism number 3, Dr. Hanuman talks of knowledge of disease. Right? He says that we should have knowledge of the disease. Whereas I remember in my college days, we were taught that don't consider disease. If there are 2 cases of asthma, forget about asthma. Prescribe for the patient. So when we talk about this, that prescribe for the patient, we forget and we neglect the knowledge of disease. And that is the point where we don't give result with certainty. The knowledge of disease. हमारे को बोला कि अस्थमा है, तो whatever symptoms, common symptom of asthma, ignore that and prescribe. But friends, when Hanuman said knowledge of disease, he didn't mean that knowledge of disease, knowledge of symptoms, but to understand the pathophysiology of disease. Understand the process, what is happening in this patient. Understand the miasmatic implication of this. So what is genetic diseases? So friend, here today what I am going to share with you, see, this is my experiences of last 30 years which I have gathered in piecemeal. So I call this as GenoCare, caring genetic wellness through homeopathy. Yes, we can give good results in genetic diseases where allopathy fails, homeopathy has got good and what you say, good scope. So what are the genetic diseases? Few examples of genetic diseases which we see in our day-to-day practice are Down syndrome, Duchenne muscular dystrophy, Fragile X syndrome, Turner syndrome, Klinefelter syndrome, Marfan syndrome, and so many of diseases are there. So, एक तो problem था first, we have to read 3000 remedies, then organon, and on the top of it today I am saying that read genetic diseases in detail. Friends, my aim here is not to go into the details of each genetic disease, but understand the approach and simplify how do we understand. Today also, whenever a case of any syndrome comes to my clinic, I Google it and I try to understand what the disease is. I don't have knowledge of any genetic diseases. From this stage, I am saying that I don't have knowledge of any genetic diseases. If you ask me what is DMD, I say I don't know. If you ask me what is Down syndrome, I say I don't know. But I know how is the process. So here, the importance of aphorism number 3, knowledge of disease. I don't know anything about Down syndrome. After this presentation, if you ask me what is Down syndrome, I say I don't know. But I know what is the thing happening in pathophysiology in the Down syndrome. Are you with me? The understanding of aphorism number 3? Down syndrome kya hai? I don't know. But how to approach Down syndrome, I know. So if you see, our body is made up of cells. And in every cell there is a nucleus and we have chromosomes. So we have XY sex-linked chromosome and we have autosomes. And then each chromosome is a double helix structure made of DNA and there are genes. So friends, if you try to understand these genetic diseases, then the diseases are basically in 2 areas. Disease can be either a problem in the chromosome or can be a problem in the genes. Are you with me? The problem can be either in the chromosome or the problem can be in the genes. What do we mean by that? So we can categorize all the genetic diseases into these 3 categories. First is the problem with single gene mutation, where a single gene is affected. And there we have, when you talk of gene, we have autosomal and sex chromosomes. There are few examples when we talk of dominant genes, recessive genes. Again, I say that knowing this is important. Knowledge of disease is important, but more important is to understand what the disease is. So all genetic diseases can be categorized into three categories. First is single gene mutation, where the problem was in the genes. Are you with me? I'll just go back again. Problem can be either in the gene or problem can be in the chromosomes. Are you with me? Say yes loudly. Good. Good morning to everybody. After a nice breakfast, huh? So now let us understand the categories. When we talk of categories, it can be the problem in the gene, right? So this is called as a single gene mutation, or the problem can be in the whole chromosome. Problem can be in the chromosome or problem can be in the gene. And when we talk of problems in chromosome, there it can be a numerical problem or a structural problem. So when we talk of numerical problems in chromosome, we have Down syndrome, Turner syndrome, Klinefelter syndrome. And we have, when you call it the structure of the chromosome is affected, we have Prader-Willi syndrome and XYZ syndrome. Friend, understand what I am saying? So problem can be either in gene or chromosomes, or we have a third category where the problem is in multi-gene. Multifactorial genes are affected, which means that more than one genes are affected. Those are not expressed, but with the environmental influences, those genes are expected, and we have diseases like diabetes, disease like rheumatoid arthritis. So friend, these are the three basic categories of genetic diseases which you will face in the clinic. So I'll repeat again. I don't know what is Down syndrome. I don't know what is Klinefelter syndrome. I don't know what is DMD. But when I see a case of DMD, I can very easily categorize whether the problem is in the genes or the problem in the chromosomes, or cases like multifactorial, where in the case of diabetes, I know that he has got the defective genes from the parents, but he is not expressed. But when some environmental influences, the disease is expressed. Is it easy? Okay. Aphorism number 5, another very important aphorism where Dr. Haniman talks of the exciting cause and the fundamental cause. So when we talk of genetic disease, we have to now understand the fundamental cause of this disease. So what is the homeopathic approach to genetic disease? Yes? What should the approach? Yes, tell me. Good morning again. Very difficult to take first lecture in such a large gathering. How do you approach genetic cases? Mother's history during pregnancy. That everybody do. But mistake we do is, what part of mother's history is important. When I started my practice, so that time there was the pediatric, I started seeing a lot of pediatric cases, and the pediatric approach was difficult. And when I look up to my seniors, so for a child of infant, 6-month-old infant coming to their clinic, they used to say that take the mother's history, send the child home, take the mother's history and prescribe the remedy to the child. Friends, this is a mistake. Every child is different, every individual is different. So mother's history, when to take, is important. So in cases of genetic diseases, yes, mother's history is important. But what part of mother's history is to be taken is more important. And when you understand that, the uncertainty will become certainty. Aphorism number 3, knowledge of disease will come into play. So what part of mother's history is important? Why not father's history? What cases father's history is important? So in this presentation, I will go to share my understanding and approach on mother's history during pregnancy, and I call this as a timeline of mother's history during pregnancy. Very important factor for us is to see the mother history during pregnancy, but the timeline is very important. What time you have to take the history is very important. So what is MHDP, mother's history during pregnancy? Find out the mother's remedy. माँ की जो रेमेडी है वो बच्चे को दे दो. Find out the mother's remedy. और find out the mother's stress during pregnancy. But why are we leaving father? Father को क्यों छोड़ देते हैं हम? Should we leave father? Yes or no? No, father. So as we celebrate Mother's Day, now we are also started celebrating Father's Day, right? So as mother's history is important, father's history is also important. So how do we solve this case? It's a genetic disease. Stress during pregnancy important. But what was the stress during pregnancy? So DMD is a Duchenne muscular dystrophy. It's a genetic disease. It's a progressive disease. And it's a muscle wasting disease. The muscles are getting affected. That is why the CPK levels goes up. Genetic means is an X-linked recessive disease. Progressive means it's a gradual deterioration of muscle strength and function, and due to absence of protein called as dystrophin, the child is affected. DMD, you all can go Google it and read from your book. So I am just going to go fast because the time is limited. We have the inaugural function after this. So I'll just go fast into this symptom. This is just taken from your medical books. So it's an X-linked recessive disorder. That the sir said that the mother is a carrier and the female is a carrier and the males are getting affected because the gene does not produce a protein called as dystrophin. Now what is the function of dystrophin? Understand, like when we have a door, the door which we have which closes. So dystrophin is a protein which restricts the closure and opening of the door. And when this dystrophin is destroyed, the muscles they open and close randomly. अगर हमारे दरवाजे में अगर वो डोर क्लोजर प्रॉपर वर्क नहीं करता तो वो टूट जाता है दरवाजा. So similarly the muscles are getting destroyed, and when the muscles are getting destroyed, they are replaced by fibrosis. So that is the basic pathophysiology of dystrophin. I'll go very fast with this. Dystrophin is a gene, is the largest gene in our body, and it contains 79 exons. After when I come down, don't ask me about dystrophin because I will not remember anything. Okay, I'll just go fast to this. 79 exons are there. It's like a glue which keeps the protein together. This is a dystrophin. Usually exon number 44 to 53 are affected. Just for theoretical knowledge purpose, understand this. There is an outframe or an inframe deletion or skip, the exons are skipped. So from 43 to 52 the exons are affected. This kind of reports you will get. So whenever you see a genetic test disease, the doctors usually ask them to do a genetic testing, and such kind of information which we get. And here it is written, if you can read this, deletion seen in exon number 49, 50, 51 and 52. So this patient has got exon number 49, 50, 51, 52 deleted. This is another case of DMD where now 6 exons are deleted from 45 to 50. It is an X-linked recessive inheritance. So try to read these reports, how these reports are looking. So this is an X-linked recessive disease, and these are the exons which are deleted. I am not going to make you all genetic expert, but I am just trying to make you aware that how to read the reports, because the patient is going to bring reports in front of us. This is another patient where they say that exon number 44 is deleted. Pathophysiology, lack of dystrophin, muscle gets damaged. replaced by fibrosis. That is why you see enlargement of the calf muscles. Miasmatic understanding of DMD, muscle gets improvement, that is SORA, increase in cell mass, psychotic, muscle get destroyed, syphilitic. So it is a predominantly psychosyphilitic disease. Signs and symptoms, muscle weakness, frequent falls, calf enlargement, gait abnormality. This is now just have a look at this. How will you clinically see and diagnose a DMD patient? See this video. This is called as Gover's sign. Whenever a child is affected with DMD, the child will, you ask the child to sit down and ask the child to get up. Without touching, ask the child to get up. What do you see? The child, when was getting up, was putting his hand on the knees and try to get up. This is a typical Gover's sign.
Okay.
This you remember.
What is the paper?
I asked the child to climb up. The child, because of the muscle weakness, the child is not able to climb up. Practically, this is important. This is called as Gover's sign. पहले का सब भूल जाओ. क्या था पैथोफिजियोलॉजी? Understand this. You have to observe this in your clinic. थोड़ा आवाज कम करो. The child is seated on the floor. Child will crouch in front, push with the hands, raise his buttocks, put the hands on the knees, form a triangle. Uses arm braces against the wall to allow standing. And then the child lifts his trunk and stand up. So if you see a patient of having complaining of muscular weakness, ask the child to sit down and get up without using support. If you see this, this is typical of DMD called as Gover's sign. So gait abnormality is there,